Today is indeed a great day for Siaya as a county, because assembled here today we are having a launch of the Siaya RMNCA Act. This is an act that has taken quite a number of time to be enacted today, and we're happy. It eventually saw the light of the day in the county assembly and was subsequently assented into law. RMNCA by and large addresses issues of reproductive health, because for us, in our Siaya, you realize there are a lot of gaps in terms of access to health, more so in issues to do with reproductive health. You realize that there are a section of this act that really defines itself to the right of every citizen to really access services of health. You find that sometimes you are engaged in an accident, you get into an accident and then you rush to seal it. This act is expressed that no health facility in Siaya will refuse to offer services to anybody that has been affected by some way of accident, which means that if there are services that you cannot offer as a facility, the Act defines that then you need to make referrals within the shortest time possible. This is majorly to avoid us losing lives, especially for an expectant mother, because sometimes we have had incidences that one has indeed lost life when they were expecting to have a kid. A milestone that we are also having here is establishment of the fund. And this fund, by and large, you realize for those that have been able to analyze the health sector for Siaya, you realize that the resources set aside for reproductive health has been very minimal. Now, this fund for us is a milestone, because then it will make sure that the executive and assembly will have to set aside funds specific for sexual health and
I represent the interest of women in the Assembly of Siaya. Today we are launching the RMNCA bill, and we are really excited, especially as women of Siaya, because this is a win for us. Two things that really have caught my heart in that bill is the issue of adolescent health, issue of teenage pregnancies, and issue of SGBV, because those are really issues that are close to my heart. And if you look at even teenage pregnancies in Siaya, we are at 21% against the national figure of 15. And so if we can work on this thing, because we are losing a lot of girls in between our fingers. So we are looking at that, and the fact that now we are going to target, focus interventions towards this issue is really, really, really exciting for me. One thing we have to know is that reproductive rights are like human rights. And so we are going to it's like a game changer for us, the people of Siaya, specifically the women. But this bill covers everyone across board: women, men, children, adolescents. Each and every person is covered in this bill. And so we allowed the governor for assenting to it. Most importantly, I am very excited on how the partners that we work with in this space in Siaya came together and put their heads together and supported it. And if we can continue with that approach, that kind of approach of all coming together and we're working on one thing that can help the county instead of everyone doing something little. So if we can focus that and focus our efforts, then I think we are on the right track.
I'm Pamela Josephine Anyango. I coordinate reproductive health. I work with the county government of Siaya. And we are glad that today we are launching the RMNCA Act. And this has been a journey since 2019. And we are glad that it will now act as a guide when we are implementing services to maternal mothers, right from the preconception period, that is before someone conceives, when they're now coming to the clinic once they are pregnant, And even when they are coming now to deliver, to ensure that they have skilled birth deliveries, and even after they've delivered, taking care of the mother and the baby. So other than taking care of the mother and the baby immediately after delivery, we as a county, we now have a law that will guide us when it comes to looking into the life of the child. Now from the child we move to the adolescent. We have cases and a guideline that will be helping us when it comes to giving age-appropriate sexual information to the adolescents. We know that as a county, we are faced with high teenage pregnancies. We are faced with issues of the triple threat, which is high teenage pregnancies, the new HIV infections, and it is a real threat to us. So we are glad that with this act, we'll now be able to have an implementation framework that will help us within the county to ensure that it will be all-inclusive, both men and women, when it comes to their reproductive health rights. There will be a guidance when it comes to offering services, and we believe that we'll have very good outcomes as a county.
My name is Isaiah Ochieng. I want to speak on behalf of partners that have come together to support this great initiative of launch of Siaya County Reproductive, Maternal, Neonatal, Child and Adolescent Health Act 2024. Today marks a milestone for Siaya County as we launch this document that will be able to see health services improved, especially targeting adolescents, women and men of reproductive age. We as partners remain committed to support the implementation of this act and even drafting of the regulations that will ensure that county appropriate resources to ensure that implementation takes place. However, we also commit that we will be able to work with the department and county assembly to ensure that we come up with implementation framework to ensure that there will be a smooth implementation of this act moving forward. So thank you so much, and we look forward to ensuring that this document is actualized through common mwananchi within Siaya County. Thank you.
I'm Sharon Bori, and I'm here to represent the youth in Siaya County. And under RMNCA, what I can say is that the benefit of RMNCA to us youths, mentally it will help us deal with the mental health of us youths. And another thing, it can also help us to deal with the primary health care. And under that, we can talk of vaccination of children, immunization, health education, and all that. Another thing, the benefit also, it can also help us to the youth. We can to the youth who are not ready to get children as well. It can also help us to improve family planning. Yes, and another thing to youth, we can talk of. Family planning, we have got several ways or types of family planning. So as youths, it can help us on that. Yeah.
My name is Cynthia, Assembly of Siaya, and I'm also the Health Committee. So I'm going to read the speech from our chairperson.